When my grandfather DJ qualified as a medical doctor back in 1912, just like nowadays, he used a stethoscope, dispensed advice, and wrote prescriptions. Like all physicians, he took the Hippocratic Oath, which essentially means primum non nocere, or first, do no harm. Of course, prescribing options were far more limited back then. Perhaps the listening ear more valued than the latest breakthrough drug. And of course, back then, some things were very different. Infectious disease was rampant. And so it was such an exciting discovery when penicillin arrived on the scene. Now, for the first time, infections like diphtheria, pneumonia, even rheumatic fever could be successfully treated. But just as all that glitters is not gold, so more of a good thing isn't necessarily better. Fast forward to nowadays, and I've had to ask myself so often, are we truly living by the Hippocratic Oath of first do no harm that we all took as doctors when we qualified for medical school? Because right now, we're dealing with what I call the calamitous and catastrophic consequences of the pill for every ill. The numbers are absolutely shocking. More than 100,000 deaths in the United States from the side effects of legally and properly prescribed pills. Death by prescription. Right now, we're dealing with a tsunami of lifestyle-related chronic health conditions. I see it every day in my surgery. From diabetes and dementia to coronary heart disease, even some cancers. The answer is so often found in the prescription pad. And the truth is, if someone suffering from chronic health conditions were to be treated according to evidence-based guidelines, that person may be taking more than 15 pills a day, more than 450 pills a month, more than 5,000 pills a year. That's a lot of side effects. Nowadays, there's pills for all sorts of things. We even have a pill for internet shopping disorder. Pills that promise protection against aging. The increasing medicalization of normality. And in the background, Big Pharma, the poster boy with their persuasive advertising, fanning the flames, funneling an illness-based model of healthcare towards what I call Pharmageddon. The pill for every ill. Now, I'm not anti-pill. In fact, penicillin, if available, would have successfully treated my granddad DJ's rheumatic fever, prevented the later heart complications that led to his untimely death. Modern medicine saves lives, but so often it's simply seen as the sticking plaster solution, papering over the cracks, when what we need to do really is get down and address the root causes. I'm reminded of Thomas Edison, the inventor of the electric light bulb, who had a lesser-known light bulb moment about healthcare many years ago when he said, "The doctor of the future will prescribe no medication, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease." Such words of wisdom. Because I believe the doctor of the future will prescribe lifestyle as medicine, and that's why I've become part of this new emerging global movement called lifestyle medicine. That positive lifestyle habits can become part of every consultation about health and well-being. That we can embrace lifestyle not just for treatment, but for prevention and even reversal of disease. So our challenge is to face down Pharmageddon and the pill for every ill, and instead embrace lifestyle as your best medicine. Eat real food, move much more, sleep much better. Because your DNA is not your destiny. Your lifestyle is your destiny.